Hi, everyone. My name is Blossom Onunuku. I am going to be the moderator for this talk. First of all, I want to thank you all so much for participating in Black in Data Week and coming to this session. So in this session, we are going to learn about becoming a healthcare data analyst in 2024 by Alana Esty here. So thank you all so much for coming. And Alana, it's up to you.
Great, thank you so much, everyone. And I'll be giving an overview on the common skills used in the health informatics field, and specifically in the healthcare data analyst role. So I'm also going to be providing some tips on how one can prepare for applying for jobs as a healthcare analyst. And I'll try to get to any questions at the end of the presentation. And I'll also leave my email in the chat if you'd like to contact me directly. So just a little bit about me. I have my background in biomedical engineering with a focus on analyzing healthcare data to improve health outcomes. I currently work in the health informatics space in Ontario, Canada. And during the pandemic, I began a podcast called the Health Analytic Insights. And I started this podcast as a way to help people to break into the field of health informatics and also meet other aspiring informatics enthusiasts. And during the run of the podcast, I had an opportunity to interview many people who broke into the field, and I hope to provide some of their advice along with my own work experience to help others who are interested in the field of health informatics. I also love all types of fries. So in this presentation, I'm going to go over a couple of questions. So we're going to look at, exactly what is health informatics? What are some common skills in this field? What does a typical day in the life look like in this role? What are roles you can search for today? And how can you increase your chances of getting a job in this field? And these are not just questions I pulled out of the sky. These are questions that I've received from listeners of the Health Analytic Insights podcast. And these are questions that I often see over and over again on the different social media platforms I run. So a general definition of health informatics, and this is from the Healthcare Information and Management Systems Society organization. So if you're interested in this field, I would highly suggest checking out this organization. They have several volunteer roles and different chapters across North America that you could join if you want to learn more about the field. They also have a job board. So there's health informatic roles posted there as well too. So I suggest checking out this organization. So they define health informatics as the integration of healthcare sciences, computer science, information science, and cognitive science to assist in the management of healthcare information. I describe health informatics as transforming raw, messy, unstructured data into actionable information to improve clinical workflow and ultimately patient outcomes. So here's a quote that's often attributed to Peter Drucker, which is, if you can't measure it, you can't manage it. And this is very true of the field of health informatics, as healthcare organizations collect huge volumes of unstructured and structured data from medical images, lab results, administrative data, EHR records, and much more. So being able to make sense of this raw data and transform it into information for actionable results is a large part of the healthcare data analyst role. If we take an example that you might also be able to relate to, whether through budgeting, having a Fitbit, or keeping a food diary, there can be positive impacts to tracking personal metrics in your life. I remember when I first started to keep a food diary, this is a big aha moment for me because it allowed me to see how many fries I was consuming on a daily basis. And once I had the knowledge, I was able to take action if I desired. Human beings are notorious for over or underestimating situations, and being able to track things is key to be able to make informed decisions. So we see an example of this from the Phoenix Children's Hospital, and here I have on the screen a dashboard, a picture of a dashboard that was developed by the staff at Phoenix Children's Hospital. And during the height of the pandemic, many hospitals paused elective surgeries. And this was the case at Phoenix Children's Hospital. The issue they had was how to resume the deferred surgeries after the peak in a timely and efficient manner. So to support this, a dashboard was created that could be viewed by multiple surgeons and support how they would prioritize these deferred surgeries. Instead of having a disorganized system of emails, paper notes, and other files, the dashboard housed necessary centralized information where clinical staff could easily navigate and plan their schedule on a day-to-day basis. Specifically, the creation of this dashboard allowed surgeons to review cases and assign priority from high, medium, or low to both backlogged and new cases. Dr. Vadia, Chief Medical Information Officer at Phoenix Children's Hospital, stated about the dashboard, the technology allowed for synergies across the enterprise and addressing the multifaceted challenges of resuming these operations. Here we see a prime example of how health analytics can make a significant difference in improving hospital operations and bringing different departments within the organization together. And this example does not exist in isolation. If you search in Google Scholar, you'll see several examples of how dashboards can be a part of the solution to improve patient care. So now moving on to some of the common skills that you'll see advertised in this field. If you start to look at enough job descriptions, you'll start to see some patterns on key skills that are often advertised for roles in the field. These skills include, someone with relevant clinical experience or a degree, and this could look like someone who's worked previously as a nurse, pharmacy technician, a clinical research assistant, or at the help desk at a hospital. And it could also be through obtaining your master's degree in a relevant field, such as health informatics or biomedical engineering. You might also see these roles advertised for people who have experience with data visualization tools. This can be something as standard as experience building charts and graphs in Excel to experience with more advanced tools such as Power BI, Click, or Tableau. If you're interested in learning about the data visualization field as a whole, one tip I have is to download Power BI Desktop, which you can do for free, and search for Power BI on Microsoft Learn, which is a website which contains tons of free tutorials where you can beef up your data visualization skills in this space. One programming language that you might see advertised over and over again for roles in this field is experience with SQL. And this stands for Structured Query Language. And this is a programming language that is used to interact with data stored in databases. With the move to digitizing healthcare records, the amount of data that is stored and collected in organizations has exponentially grown. This is one of the reasons a career in health informatics can be fulfilling, because the problems are always changing and there's never a dull moment. You need to be able to sort through all different types of healthcare data that exists, from healthcare claims, blood work data from the lab, and patient demographic information. And SQL is used to sort through tons of data and organize messy data into actionable information. And later on in the presentation, I'll give an example of how this can be done by writing SQL queries. Finally, strong communication skills is key in most roles, but is especially important in the health informatics field. Oftentimes, you might be the analytical translator. And this is a term that was coined from a McKinsey article, which describes the health informatics role to the T. One day, you might be meeting with clinicians who would like a program or report which helps them to better track certain clinical metrics they might not be aware of. And then one day you might be meeting with IT or developers to communicate them the requirements that clinical stakeholders have provided to you to either work with them or get their guidance in building a tool that builds a solution. So now I'm going to move on to what a typical day in the life might look like for this healthcare data analyst role. So one of the issues that are common to the healthcare field is the effect of readmission rates back to hospital. For example, in the Canadian Institute for Health Information in 2018 estimated readmission to hospital costs more than $2.1 billion a year in Canada. And most importantly, it often leads to negative adverse effects for patients. So luckily, there's been some research which has shown a reduction in patient readmission rates when there's a follow-up call by a community nurse. And this might be linked to increased medication adherence, and also patients feel supported. So imagine your boss wants you to create some analysis around identifying diabetic patients who are at risk of readmission back to hospital so that she can pass this information on to community nurses to follow up with these patients after they are discharged from care. So in the role of an analyst, you might think the first step is to just jump into the data and start doing your analysis. But oftentimes your first step would actually be to have conversations with clinicians. And you would want to make sure you're understanding the problem before you start doing any additional analysis. This could look like asking the community nurses, what are the key characteristics of patients who are often readmitted back into hospital? Do they tend to be on several different types of medication? Does it tend to be age-related? And this is where your relevant clinical experience can come in handy to help guide your questions. So once you have that correct frame of reference from having these conversations, the next step then would be to jump into the data. And here I'm showing you a data set of some SQL queries. And this data is fake data, which is sourced from an article called Impact of HbA1c Measurement on Hospital Readmission Rates, Analysis of 70,000 Clinical Database Patient Records. And so I'm not showing any real patient health information. It's all fake data. So what I'm showing is in the SQL query, you can do a select statement to actually showcase the information in the patient demographic table. And so you see some columns such as the patient health card number, race, gender, age, weight. And I have another select statement, which will look at the patient diagnosis information. And this table has a lot more information in it. You have time in hospital, you have the number of days they're in hospital, number of diagnoses for the patient. And so this table has a lot more information than the demographic table. And it also has a really important key column, which I'll be showing in this video, which is the patient readmission rates column. So you see here, it tells you if the patient was readmitted, no, or if they're readmitted within 30 days. So with SQL, the purpose is really to join different tables together to get a fulsome analysis. So you'll see here, I will join both the patient demographic table and the patient diagnosis table together on a similar column, which is the encounter ID. And so this allows you to do more full-scale analysis, because now I can take this table and break it down by age or weight and see if that has an effect on if the patient had a higher risk of readmission rate or not. That's just an example of how you can write SQL queries to do further exploratory analysis. And here what I'm showing is the use of Power BI. So when you're having conversations with clinicians, you don't want to just show them that raw SQL query code that I was just showing in the last slide. You want to summarize your information into certain points. For example, here I'm showing, what are some of the key indicators of patients who are being readmitted back into hospital as a result of the analysis that I did sorting through the data. And so you want to go to clinicians and have these conversations in a way that's easily digestible, and that is often in the form of charts and graphs. So just to recap, a typical day in the life might look like step one, having conversations with clinicians to sort of frame your analysis, then writing queries using SQL language, sorting through the data, doing your exploratory analysis, finding those outliers, and then creating graphs and tables in a data visualization tool such as Power BI or Tableau, and then presenting your findings to senior managers or clinicians and having those conversations. And that might even lead back to doing further analysis. So it can really be a cyclical structure. So now I'm going to jump into what are some job roles you can search for today in this field. So oftentimes I'll get this question from listeners of the podcast. What job should I be searching for? I don't even know where to start. And this makes a lot of sense because this field is relatively new and doesn't tend to have established titles such as a project manager or business analyst. Therefore, I advise people to search for a technical tool they might have expertise in, plus the word healthcare. For example, one can search in Power BI plus healthcare or R plus healthcare into the search box of Indeed or LinkedIn. And once you start searching enough, you'll start to see some common job titles appear. And they all tend to have the title analyst in them. So for example, I have some on the screen here: clinical systems analyst, EHR analyst, information system analyst, clinical decision support analyst, and application analyst. And so these are some job titles that might exist where you're located. Another tip is if you currently work in a clinical or healthcare organization, you might want to see if your organization has a business intelligence or clinical decision support department and see the roles within this department. And if you have a chance, try to job shadow with some of your colleagues to identify any technical skill gaps you might have that might be solved by taking a course. And taking a course, this might help to improve your job application because you'll be able to kind of reduce that gap that you might have. Although getting a job can be equal parts timing and luck, just throwing your resume into the void of LinkedIn or Indeed can feel like you're not even moving the needle on your job search. Instead, you can consider developing your technical skills in Power BI and SQL by creating a portfolio project with a clinical lens to help develop and showcase your technical skills, especially if you already have a strong clinical background, working previously as a nurse or pharmacy technician. So creating a portfolio project can be a great way to show to hiring managers that you also have the necessary skills, which can help to strengthen your application when applying to jobs. I've had the opportunity to review several resumes from individuals looking to break into this field. And what I often see is just a simple listing of a technical tool like Power BI or SQL. But being able to show concrete proof of your proficiency in this tool with the creation of a project can be a boost for your application, especially in this competitive job market. So one of the major hurdles to creating a clinical portfolio project is the lack of open source clinical data sets, which exists because of the risks of releasing personal health information publicly. Therefore, you can find tons of data analytical courses using the popular Microsoft AdventureWorks dataset. But it's much harder to find an analytical course with a clinical lens. So this is something that I struggled with when I first pivoted into this field. And I created an online course with a clinically focused dataset, which uses fake dummy data, which you can use to create your own portfolio project. I also walk you through in detail how to write common SQL queries, and we walk through step by step on how you can build your own hospital KPI dashboard using Power BI. As a result of completing this course, you can showcase this dashboard with a unique link that can be embedded in a professional blog or hyperlinked in your resume for hiring managers to see an initiative you took to get that first role. Completing this course will provide you with an opportunity to speak to the specific data cleansing methods you applied and the overall technical skills you have gained. And for participants of this presentation, I have a discount code for 10% off until Monday, June 24th. So now I'll just end off the presentation with some quick tips on how you can enhance your resume if this is a field you're interested in pivoting into. So if you have a clinical background, I would highlight this in your resume summary and any technical skills you have gained through self-learning or taking classes. Vice versa, if you have technical skills and are looking to work in a healthcare organization, highlighting these technical skills in your resume summary, and then any volunteering or internships you've done within a healthcare organization would be good to emphasize. I've had a chance to review several resumes, as I previously stated, and one thing I've noticed, especially with clinical individuals, would be oftentimes they forget to include the experience they have with electronic health record systems, such as Epic and Cerner, especially if they were in a super user role, so they had additional training on these systems. I might have even trained other clinical staff. This is really valuable to include on your resume. Earlier, I talked about the clinical business intelligence portfolio. And if you have no prior experience, might be good to create a project which goes through the steps of solving a current healthcare issue, such as readmission rates, using open source data sets, and documenting the data cleansing steps, the statistical analysis and exploratory data analysis that you took to arrive at the conclusion of your project. And then visualizing this information using a tool such as Power BI or Tableau to summarize your end results. Finally, linking the portfolio project you developed in your resume might be a good way to stand out to employers. So thank you for listening to my presentation. If you have any specific questions, you can definitely reach out to me at healthanalyticinsights@gmail.com. And I have a YouTube channel where I create several videos on how to break into the health informatics field. And I'll take questions now if there are any. So thank you very much for listening.
Thank you, Elena. We do have a question from Naima, I believe. Would any of these roles require an analyst knowing Python?
So it's not required. But I find that the healthcare field is slow to technical changes. Even in my current job, we're just moving away from SAS now and then moving more into R. So it's not required. I think it is definitely a benefit in the future, especially if you want to go into the like a healthcare data science role to know Python. But it's not required at the moment, but I think it'd be a good future skill to learn.
Excellent, excellent. Any other questions? I was just going to ask, Elena, would you be able to give a salary range for what people can expect?
Sure. So this is in Canadian dollars. I would say around 60 to 80 for like someone who has 3 to 4 years of experience, and then it definitely increases as you have more and more experience and take on more roles. I found that people who move from the analytics side to more of the quality improvement side of things can get into those management roles where you're looking at 100K plus. So this is a good starting career in the analytics field because you can go in many different directions. You can go into quality improvement. You can go into change management. I even see people going to project management. So this is definitely a good mid-career area to go into.
Awesome. Thank you. Oh, we have another question from Lolu. Lolu asked, what are the top difficulties experienced when starting or during an analytics project?
That's a great question. I think definitely the starting part that's difficult is just sorting through the data because it can be overwhelming to even know like where to start. So I think, again, having those conversations with those clinicians can really help to kind of narrow that down. I found that in the past, if I just start jumping into the data, then I can start going off into tangents that are not really relevant. But I found that once I have those conversations with clinicians, it helps me to kind of really focus in on what I exactly need to be querying. So I'd say that's definitely one of the difficulties and things that I first ran into when I was starting any analytical projects.
Wonderful answer and great question, Lolu. Thank you all so much for coming, and I hope to see you all in the next session.
Thank you. Bye.
Take care, everyone.